This is pretty standard what you'll see in an urgent care or a freestanding emergency room or an emergency room. It's an ER laceration tray. They all carry about the same thing. So we're going to open it up in just a second. But let's go ahead and take a look. Now remember that laceration repair is not a sterile procedure, but we try to be as clean as possible. Okay. Okay, let's take a look. So first we have our drapes, our fenestrated drapes. So here's that. And then you're going to find this in all of them as well. So this really will hone in on the lac repair. So it's your drape you're going to put on the patient at some point. You know, it has some stickiness right there. And so it sticks on the patient. And then you can do the lac repair without having to worry about anything else right there in your field. See, that's pretty cool. That's what this is. We have our 4x4 gauze. We have our 10 ml syringe. We have our 2x2 gauze. We have here Q-tip and applicator tip or whatnot. So there's two of them in this one. That's cool. I usually don't see these in the kits, in other kits. Okay, we have 2 cups. Well, why would we need these? Well, if you're doing a laceration repair using a buried suture, one tip is you put some saline in here to keep the suture wet every time you go through, because a buried suture is an absorbable suture, and those usually need to be kept wet or they dry up pretty fast in the air. And then the other one, you can put your other sharps in as well, you know, when you're done. If you're going to do more than one, you know, if you're going to use a lot of thread, you end up using that. So tools wise, we have our scissors, we have our pickups, our Adsons, and then we also have our needle driver. So these are the 3 main tools. Here we have the hemostat. You can use it for other reasons, you know, for debridement or wound undermining or things, but typically not going to use this very much in the laceration tray when you're doing a straightforward laceration. All right, so what kind of needles do we have? This one comes with 3. So our big boy, right? And I'll connect them to here just so we see them. So wow, now you're obviously not going to stick this 18 gauge into somebody, right? So what you're going to do with this, is you're going to draw up your medications. So this is your drawing needle pretty much. So when you're doing the actual numbing the patient up, you're going to use this 27 gauge. Look at that, beautiful. Then you're going to have to push a lot more, right, because there's going to be a lot more pressure, but this is a great one. Perfect. What I would use. And then lastly, your small guy right here. Some more superficial stuff, and you know, wounds that don't need to, you don't have to go deep or really anything else. So here you have the smaller one as well. So this is your kit here. Honestly, sure, write some shit down on there, whatever. And this is your standard tray, pretty much.